E eu tô aqui com o Dr. Mannstadt, que veio diretamente de Boston para dar 2 palestras pra gente, falando sobre hipoparatireoidismo e hiperparatireoidismo. First of all, Dr. Mannstadt, I'd like to thank you so much for joining us at our conference. It's such a pleasure for us to have you here, coming all the way from Boston during summer, so we know especially how important that is. You just gave the talk on hipoparatireoidism, the new concepts of hypopara. Would you like to give us one key highlight on the message about hypopara that you think it's important for those who are watching us?
Yeah, well, first of all, thank you very much for having me here in Brazil, my first visit to the country. Hypoparathyroidism, first of all, it has really evolved into a disease, while it's rare, that got a lot of attention, which is really nice. And that's mainly driven by having new medications on the market. My message is to continue working on hypoparathyroidism, on novel treatments, and also understanding the disease better than we did in the past, where we just thought, okay, some calcium and calcitriol will be enough. But we now understand it's way more complicated.
And regarding treatment, what is in the horizon for the new treatments of hypopara, and how does that impact in the quality of life and different outcomes in the patient who bears this tragic disease?
Yeah, so we are very lucky and happy to have an FDA-approved medication, terapêuticas, at our disposal for patients with hypopara, which is an injectable long-acting PTH, keeps the serum calcium up over 24 hours and the urinary calcium low, and normalizes the phosphate. So that's really, really nice. Quality of life increases. So we're very happy having this. Of course, we always want more, and so having more than one available drug is always of advantage for patients. And then secondly, there are developments in the area of oral medications. An oral PTH, either as PTH itself or a small molecule agonist to the PTH receptor. And these are potentially very interesting developments, early in development, so we will see in the future what this will bring.
And for the clinicians who are watching us, if you could give one practical recommendation for them to tomorrow when they are in their practice, to start doing when they get a patient with hypopara, what would that be?
Something very obvious is listening to the patient, because sometimes we think we know what the patient needs, not realizing the patient actually is focusing on something else. Often has something to do with quality of life or with the medication that we give. So try to figure out in the short time that we have with patients what is on their mind, what bothers them most, and then try to tailor our conversation and management according to that. And of course, don't forget to measure 24-hour urine calcium, because that the goal is really to keep it as low as possible with conventional treatment if patients is on calcium and calcium bar.
Perfect. Thank you so much, Dr. Mannstadt, once again. E finalizamos a nossa conversa sobre hipoparatireoidismo. Nos vemos nos próximos vídeos.